My name is Olivia Saracino, and the topic that we will be discussing is, should younger patients be made a priority to receive organs from organ donors? The factors that we will be discussing are clinical implications, challenges, pros and cons, who is most affected, and how it is related to healthcare. These factors will help prove each person's point of view.
So, should younger patients be a priority in organ donation? So, there's a lot of not only ethical implications to this, such as religion and all that other kind of stuff, of people who believe that a body should be preserved a certain way and not be dug into and used for any other purpose besides being preserved. But there's also a lot of clinical implications, such as it's not a matter of who can get the organ, it's who can get it when it's still viable. So a lot of the times an issue is an organ has to be used within a certain time frame of it being removed from the body. So certain people will get the organ, and even if they're not the perfect match for it, it'll be who's the best match and who can get that organ as long as it's still viable. So it's almost impossible to decide whether a younger person should get it or not. It ends up just being who can get the organ when it's viable.
In my opinion, younger patients should not be made a priority to receive organs during an organ transplant. My reasoning behind this is because the age should not be a factor of an organ recipient. Every life is precious and valuable, in which everyone should be given the equal amount of opportunity to live. The transplant should be dependent on a patient's situation and determining which patient needs it more. The challenges that go along with this question include, what is the cutoff age that determines a younger patient from an older patient? This leads to my question determining who is most affected. In order to know who gets an organs, a certain age would have to be distinguished. This can be controversial, however, because there are different interpretations of young and old. In a case where the cutoff age is 15, would a patient not be made a priority because the patient is 15 and a few months? Another challenge regarding this question is if the patient is younger and they are made priority, older patients would not be given the opportunity for organs because they would not be considered a younger category.